hour of 9:30 has arrived, and I'd like to call the HHS committee meeting of February 2nd to order. Looks like we do not have a physical quorum, so under 7E of OMA, members can participate virtually. Our representative officers are present at our regular meeting location. Online in-person public comment has been provided for, and health protocols are in the room. All votes will be roll call votes. And with that, Karen, can we have a roll call, please?
Sure. Chair Renahan.
Here.
Vice Chair Swarzy.
Here.
Member Selman.
Here.
Member Chaplin.
Here.
Member Desart.
Here.
Member LaPlante.
Here.
Okay, do we have any public comment?
No public comment.
No public comment. All right, so I have a few things I just like to mention. We do have the Care Center balloon fundraiser accepting donations until February 10th. $4 a balloon. This year we don't get to deliver in person. New members, that's something that we've gotten to do in the past. But we have great opportunity to give back, and the funds go to recreational art items like arts and music and things like that for our residents. So please participate in that. I'd like to congratulate Janelle Chadwick and her DuPage care team. As I mentioned at the county board meeting, they received a 5-star rating, and I hope she'll tell us just a little bit about that when she comes to speak. Regarding our community services, Mary gave us a great report on the $27.3 million in rental assistance coming our way. And I appreciate everything she's doing to loop in this committee, even though the funding is actually going to go through county board, just so you know, but just we will be, getting the information hopefully here first. So finally, I just wanted to say, I think we all received a press release on senior services has begun an initiative this fall they start this fall to help caregivers of people 60 and over with supports to prevent burnout and to make sure they can take care of their own health. Because if our caregivers get sick, that's 2 people that go down, not just 1. So they do a survey and assessment, and then community service can advise on what to take advantage of and how. And I spoke with Jenny Shalala.
Yeah, and she's actually on, so later in my update, if anybody
Oh,
has
great.
any questions.
Okay, so am I stealing out of your update? I'm sorry.
No, it's fine.
No. Anyway, I appreciate that, we've got people taking initiatives on things that matter so much to us, our seniors. And so I guess she can give the info of when, what, where, and how. So with that, I will ask for a motion to approve minutes of the HHS meeting of January 19th.
Second.
Any corrections, additions? Roll call vote, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Swarzy.
Aye.
Member Selman.
Aye.
And Chair Renahan.
Aye, and we have member Rutledge in attendance as well.
Yes.
With that, can I ask for a motion to combine items 6A, 1, 2, 3, and 4. These are all community service block grants for low-income, homeless youth and residents, including Home DuPage, 360 Services, Catholic Charities, Hope House, Outreach Community Services.
So moved.
Second. Chaplin.
Questions, comments?
You wanted to say something about the date? So all of these contracts start January 1st, even though today's February 2nd. That's because the contracts follow the term of the CSBG grant that we get from the state, but the state is always delayed in getting us those grant agreements. We approved them at the last board meeting, so we can't put the contracts through. These are, for the most part, all continuations of existing programs that we've been funding for a period of time. So the agencies just continue operating in the good faith that we will make the payments retroactive to the beginning of the term.
Any questions here? Roll call on combining.
Member Swarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Chair Renahan.
Aye. And do we have a motion to approve those same items, 6A, 1, 2, 3, 4?
Start. Second. Chaplin.
Again, questions, comments? Roll call vote.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Member Swarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Chair Renahan.
Aye, thank you, those are approved. Do I have a motion to approve item D, CFPB, contract purchase for Midwest Shelter Homeless Veterans, life skills for homeless veterans, $25,000.
So moved, Chaplain.
Second.
Questions, comments? Roll call, vote, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Solomon.
Aye.
Chair Renahan.
Aye. Thank you, that's approved. We have one item from the DuPage Care Center. It's a recommendation for approval of contract purchase order Canna Gold Baking Company, basically for the campus, which is Care Center, this building and judicial building, not to exceed $29,600.
So moved, Chaplain.
Second.
Questions or comments? All right, roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Solomon.
Aye.
Chair Renahan.
Aye. That's approved. Next item, we have a change order for Pace Suburban Bus Service, which provides no change to contract total. Do you have a motion?
So moved, Chaplain.
Second.
Questions, comments? Roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Solomon.
Aye.
Chair Renahan.
Aye. That's approved. We have one budget transfer. It is Illinois State LIHEAP grant agreement, moving funds from client assistant to program support category, $85,697.
So moved, Chaplain.
Second.
And questions, comments? Roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Solomon.
Aye.
Chair Renahan.
Aye. That's approved. We do have one residency waiver here.
Yes, hi, good morning. We have a candidate requesting admission. It's a 79-year-old female. They did live in DuPage County for 38 years previously. We currently have 4 male, 12 female beds on our open units. There would be no DuPage County residents displaced by accepting this applicant. The granddaughter-in-law also works here at the Care Center, so we're requesting approval of this admission.
Thank you. So for our new members, we do vote on these. I'd like to thank Karen as well for kind of laying out the process of what we do to everyone. We're learning as we go. So with that, I'll take a motion to approve this candidate.
So moved, Chaplain.
Second.
Any questions or comments for Janelle?
Just a comment. I think it's wonderful that we have room and we're accepting that, 40 years is a long time living in a community and you move away for a short time and you want to come back and finish things out in that community. I think it's wonderful. So that's all.
And yes, we're getting new people.
That's right, that's right.
All right. Any other comments, questions? All right, roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Solomon.
Aye.
And Chair Renahan.
Aye. All right, so they are approved. And with that, Janelle, can you give us your Care Center update, please?
Sure, I certainly can. Since April, we've had 88 residents who have had the virus and 106 staff. We currently have 2 units that are on isolation due to a potential exposure. Our second vaccine clinic will be occurring this Friday and Saturday. We've been running around 91% residents that have opted for the vaccine and around 65 to 67% staff. We could see that number rise for staff because we have our second clinic this weekend and a third clinic at the end of the month. So therefore, staff could still get the 2 doses. We had a word that there were a number waiting to see what happened with the first go around. Last week, we had the pleasure of having our 7th infection control survey by the Illinois Department of Public Health. No idea why so frequent. They don't even understand why so frequent when they come in. It's generally a 2-day survey. I could give a whole report just on this process, and it's defunctness. But anyway, we ended up fine. There were no findings. Annual surveys, the facility undergoes an annual survey, every long-term care facility. It's usually about a 4 or 5 day survey. Based on our building, we could have anywhere from 9, 10 with life safety code surveyor, in excess of that in the building for numerous days doing a full review. Those annual surveys were put on hold during COVID. Now they're starting up again. And there's so much confusion at the state level, they don't know if they'll still try and do 2 annual surveys in a very short period of time, which would not make a lot of sense and would be an incredible burden to the facility. But CMS and the state have not figured out how they're going to address that. So those surveys are back up and running and could occur at any time. They generally come in on Tuesdays for us, but it's unannounced. My husband is also an administrator in the field, and he just had his annual survey and the life safety code portion, which is the architect that comes in and looks at every single, you move your ceiling tiles, you look for penetrations in your drywall or your cinder block, you have to come up with the Hilti penetration. It's a very complex process on how to fill those for maintaining your fire barriers. That surveyor was there till 8 p.m. at his building, and he told the team there that the state has told the surveyors to hit the facilities hard. So it's unfortunate that with everything that happened with COVID in the beginning out in Washington, and the reputation that skilled nursing facilities have because of COVID, when you really get down to it, that's very rare instances of poor performance. Most have done extremely well. We've been given CARES Act funds, and now they're going to turn around and try and hit us with civil money penalties and survey complaint type situations. So a little disheartening, but we're strong. We're in a great position as always, and we'll keep pushing forward. In light of this, Julie mentioned about the 5-star rating, which happened. This fluctuates as well. It's the methodology, like everything else with the state, is very complex and moving targets. They're called cut point tables. So it analyzes, we have to insert complex data for every single resident on a periodic basis. It's the volume of information the team has to put in for every single resident for payment is extensive. They use that to analyze our data. So like if we have someone whose needs are increasing with their activities of daily living, that would be kind of a mark against the facility. If we have someone who falls with major injury, that's a mark against the facility. All those things drive our rating in addition to our staffing and our survey history. So based on all of that algorithm, we are now a 5-star facility. So huge accolades to the team. This is something that, like I said, does fluctuate, but we work on that on a continuous basis. So lots to report. Sorry about that. Any questions?
From the committee at all? Member LaPlante?
Yes, I have a question. Thank you so much for that report and congratulations on your 5-star rating.
Thank you.
My question is about the number of staff. Can you please repeat that? Did you say 67% of your staff is opting in for the vaccine?
Yes,
Am that correct?
initially, yes.
Okay, and is there a reason behind the 33% that is opting out of that vaccine?
You know, they're all personal reasons. Actually, that's above average for the industry. The industry is running 50 to 60%. So we're actually above that. To speak, like I said, I think many were waiting. We have some that have been contacted by their primary physicians, so they're opting to go there versus here. We don't have all that data yet to finalize our numbers. There's some that are pretty extreme conspiracy theorists. I'm sure you've heard those situations too. We have a few of those here as well.
Okay, so just as like they are worried, they have concerns about the vaccine, low
Correct.
vaccine confidence, put it that way?
Correct, yes.
Okay.
Yep.
And then that's what you're hoping will be addressed in the vaccine clinics, is boosting the vaccine confidence within staff?
Just based on the first efficacy of the first clinic, we're hoping that we'll have an increase for the second and third.
Okay. Okay, thank you so much.
Thank you.
Any other comments from Member Solomon?
Thank you. Just to follow up on Member LaPlante. So as we get through these next 2 or 3 appointments that you had, if you have staff who are still refusing, not on scientific knowledge, which is supposed to be their career's expertise, to take this vaccine, what are the repercussions for that? Because I think if I had a family member, I would want to make sure those people aren't interacting with my family members because they have a fundamental misunderstanding of science.
For sure. Obviously, they still have to interact with the family. They are, it's not a condition of employment, but they would have to wear full PPE year round.
They can't be put into positions where there's not staff interaction?
They cannot, no.
I think that's unfortunate. And I would hope that maybe that's something we could look at because I think we're offering care to some of the most vulnerable in our county. It's unacceptable. I think there's other, they have to get tested for TB. And they would have to get care for that. This is no different in many ways.
Well,
it could be even more lethal.
So we have people that can refuse for the flu. There's some religious components to that as well. And if they don't get the flu vaccine, they have to wear a surgical mask the entire flu season. So to say that we're going to put them in full PPE for the entire year is a significant deterrent because it's very warm and very uncomfortable. So
would there be extra testing maybe?
I'm sorry?
Would there be required testing then too? So if they refuse the vaccine and their PPE?
Yeah, Member Salmon, we're already doing probably 600-700 tests a week between our residents and staff. So the staff right now are tested twice a week. That could change, and I hope we're able to decrease that because the cost is unbelievable. It's $109 a test. So.
All right, thank you so much.
You bet.
Anyone else? All right, well, thank you, Janelle, for all you do to take care of our most vulnerable.
Thank you.
All right, let's move on to Mary Keating's community services update.
Thank you. I think I'll start with Jenny Chalela. I asked her to be on. I think Michelle needs to put her back on, right? So Jenny, you should be able to turn your camera on if you're around. Hopefully you're around.
There we go. Hi, good morning, everyone. Thank you, Chairman Renahan, for bringing to the forefront our new TCare program. As mentioned earlier, the TCare program addresses caregivers and their needs and their stresses. The case manager puts together a plan with the help of the caregiver to kind of meet those needs, whether it focuses on counseling or taking care of their own health problems or respite for their caring for their loved one. We do follow up then afterwards to kind of adjust their goals and plans based on what they've done and what their needs are, because as we know, those needs changed. Since October, we've already assessed 40 caregivers and we have another 9 caregivers waiting to be assessed, 6 from just over the weekend. So obviously it is doing some good already. So that's great. This program is exciting. We want to help our caregivers. Right now it's unfunded. Through the AAA or Age Guide, and it's scheduled to kind of end September 30th. We'd love to continue it moving forward, but I don't think we can do that without funding to go along with it. Thank you. I'm excited to have this opportunity to highlight one of the programs we do in community services, and I hope you'll continue to let us kind of tell you about the exciting things that we get to do in the community with our clients.
Jenny, can you, what's the definition of a caregiver? How does someone qualify?
Right now, the definition is caring for someone over 60. So it can be a neighbor, a friend, a relative. That definition is very broad, but the person being cared for has to be over 60 right now.
And just an acronym you might not be familiar with, AAA is the Area Agency on Aging, not the Auto Club. That's the planning agency through which we get a lot of our funding. It goes from the feds to the state to the AAAs and then down to us. So thank you, Jenny.
Thank you.
Thank you, Jenny. We spoke yesterday and Jenny said she's the kind of person that the seniors, they find her when she's at the grocery store. So I appreciate all you do, and obviously you got a very good heart.
Thank you.
Yeah, I had a couple other things that we've received, actually I'll move so that I'm in camera view. There I am. We've received the draft intergovernmental agency agreement from IDA for the rental assistance program. They sent it late Friday. There's a call tomorrow morning with the counties that are considering participation. There's a couple of, I'll call them sticking points that I saw, and I think some of us are, were a little bit surprised to see. Probably the biggest one is, it's a prohibition from us providing rental assistance, like running any sort of parallel program. I think there were a number of us who at least wanted to consider holding back a portion of those funds. I know at least one county wanted to hold it back for utilities. That wouldn't be an issue. If we wanted to hold it back for utilities, that wouldn't be a problem. But the agreement says that we wouldn't be providing rent assistance from anything that we hold back. The obvious reason they put that in there is because duplication of benefits is a significant challenge. It's a federal requirement that anybody administering these funds make sure that duplication is avoided. If duplication is found, we have to pay the funds back to Treasury. So it's definitely a significant issue. I would hope that we could work out some sort of coordinated information sharing, and I'm sure that's something that we're all going to bring up tomorrow on the call. The other one I'm not really clear on is sort of how the payments would work. The agreement seems to apply that we would be doing an upfront funding of IDA. That's probably something that our CFO would need to chime in on, as well as how the other counties feel about it. It is very, it does make a lot of sense, I think, in terms of the timeline where they talk about if by August 1st. So they're talking about a March 1st launch, and they're saying that if by August 1st, it's determined that they're not going to be able to expend 65% of the funds that we give them specifically for DuPage residents by the end of September, those funds would be opened to that regional pool. There's then a further deadline, I think, of October 1st for that same determination. If 100% of the funds won't be spent for DuPage residents by the end of the year, it would open to that regional pool. So it does sort of lay out that basic concept. Like I said, there's a call tomorrow. They will want an answer, I think, by the end of February. So whether we take this to board, I doubt we'll take it to the board next week, but we'll need to get to the board by the end of the month. So I will keep you all updated on the conversation. And then the last thing, I'm sorry, did somebody have a question?
Can you maybe re-explain how much a renter can get, and does the lesser also, can they apply for this stuff too?
Yeah, so I've seen nothing that limits the amount of funding an individual can get. They can get rent arrearages, and they can get forward rent for up to 3 months before they would have to certify their employment. It only counts on arrearages accrued since March of last year, so since the beginning of the federal emergency declaration. So that's one thing that's changing with IDA. Last fall was a flat $5,000 grant per household that could be used both for arrearages and then forward up to December.
But they would have to, every 3 months, they would have to reapply based on their unemployment?
Under the new program, yes. Yeah, that's typically how it would work. Whether they'll have enough funding to, I mean, there's going to be thousands and thousands and thousands of people who are qualified for these funds. So their ability to fund arrearages and then a 3 month advance, and then the possibility of there being further money beyond that, I don't know that this program would have the capacity. If the Biden administration is successful in their pitch to double these funds, then that could be a different story. Always keeping in mind that we have other rental assistance funds at much smaller scale, but we do have other rental assistance funds from other sources where we can always try and work with households that are in this really long-term economic crisis. In terms of, the legislation allows landlords to apply on behalf of the resident. However, they still have to collect the information from the resident. So it can be initiated from either side, but both sides have to participate. There is an allowance in the legislation that the renter could get a direct payment, but that's only if the landlord refuses to participate for whatever reason. So,
Thank you very much.
sure. Just one other quick thing.
Member Selman.
Oh, sorry.
Go ahead, Member Selman.
Thanks. Just briefly, is there any way that these grant dollars would be applied in a way that's taxable to the renters? Or is it written in a grant so that there's no tax, like there's no way that's considered income, right?
The legislation clearly identifies it as non-tax. It does not qualify as income for tax purposes.
Perfect. Okay, thank you.
Yeah, that would be kind of a kicker, wouldn't it, if you get? Yeah.
Mary, is that for the landlord as well, tax exempt?
It would be treated the way any other, the way their rent is treated.
Okay, thanks.
So,
Go ahead, Mary.
oh, okay, so some of you new members may not know that I'm the immediate past president of the National Association for County, Community, and Economic Development. We are an affiliate of the National Association of Counties. Last week, I was asked by the NASED board to accept the appointment. The NASED, each affiliate gets an appointment to the NACO board. So I was asked to take the NASED appointment to the NACO board. So I'll be on the agenda for the March 19th NACO Board of Directors meeting to be voted on to the NACO board. So I want to continue to, I'm so appreciative of the opportunity the county gives me to participate at this national level. It's obviously great for me personally, professionally. I think it's really great for the industry just to have a community like DuPage participating in these national dialogues. And it's great for DuPage to get the opportunity to weigh in on these large scale issues. So thank you.
Congratulations.
Yeah, congratulations.
Nice job.
Lucky to have you, Mary. With that, let's go to old business. Do you have any old business? Any new business? I have a motion to adjourn.
So moved. Captain.
Second.
Roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Renahan.
Aye. Thank you, everyone.
Nice job. Good job.